She is always evolving. Welcome back, or welcome to Grateful and Full of Greatness. I'm your host, Mark Glicini. On this podcast, I sit down with guests who, in my opinion, live their lives with the pursuit of greatness in mind. This platform allows us to discuss and explain strategies that go into reaching peak performance. This is episode 77, and my guest is Dr. Catherine Logan, a world-class sports medicine orthopedic surgeon. Based in Denver, Dr. Logan is a co-founder of COSMO, aka Colorado Sports Medicine and Orthopedics, where she focuses on complex knee and shoulder surgeries, as well as regenerative medicine, sports performance, and recovery. She began her career in physical therapy, and now she deeply studies and teaches injury prevention, rehabilitation, and mental wellness. Tufts School of Medicine, Harvard Combined Orthopedic Residency, Fellowship at the renowned Steadman Philippon Research Institute, team physician for USA Lacrosse and US ski and snowboard teams, and author, a co-host of the Sports Stops podcast, and a co-founder of her newest endeavor, the Unbroken Athlete. Dr. Logan is a woman on a mission. Stick around as she shares her why and how behind it all. So, without further ado, Dr. Logan, thank you so much for being here.
Thank you. I'm so excited to be here. Quite an intro, so thank you very much.
It was. I kind of need an inhaler about the whole
Yeah.
thing. And before we get into the cool work that you're doing, I wanted to start off with the last time we spoke. We were on a podcast 5 years ago. It was actually the middle of COVID. We're coming off the bubble season of the PLL. And I want to ask you more of an intangible question. And you create, you generate, and you produce. As I was getting ready for this, I saw a book that you have on Amazon, all these different things. What keeps you going and what drives you?
I think, a lot of what drives me is, just pure curiosity. I think there's so many problems, in sports medicine that we just haven't solved. And I can think back to myself even like 20 years ago when I would start to go to professional meetings and, be a little frustrated by asking a question and feeling like there wasn't an answer. So, like one of the things I think we'll probably talk about today is the psychological side of injury. Like 20 years ago, I was sort of asking those questions and understanding, like, how do we tackle this problem? And it was just like crickets, and
Mm,
I think you're sort of like, all right, well, somebody's got to figure it out. So I think that drive is really just like being a curious person.
wonderful. I mean, I see it a lot in mental performance coaching, even using that word mental. You went to the other side of the street if you use mental to describe somebody, and now it's actually becoming more commonplace. But what I love is you've always been fascinated, at least from my perspective, about the continuum of care, right? Just from all the way in the beginning of the athlete, now they're inside surgery on their outside. What is it about that continuum of care that kind of has always struck you?
I mean, part of it is it's just really neat to look at multiple things. I think there's definitely you'll meet surgeons who really just are very interested in the procedure itself, and that's it. And that's where it stops. And there's not an interest in what's happened before or what happens after. But I think those folks are just like really missing out on a lot of the good stuff, trying to, understand, all right, what puts us, from my perspective, if you understand like why someone's been injured and you understand the prevention side, it's going to help you be a better surgeon. And then similarly, like when I think a lot about what happens after surgery in that continuum and how they rehab and how they get back to sport, I think it changes the way I operate. If I see something that consistently happens after surgery as a little bit of a challenge or a setback, it's going to make me go back to the drawing board and be like, well, what can I be doing intraoperatively that might improve that step? Does that make sense?
Absolutely does. I mean, I might bring up this individual a couple times. I don't think the world knows about him enough. His name is Dr. Gabor Mate. He wrote a book called The Myth of Normal. And one of the things I was listening to just even this week is he was unpacking ADHD. Okay, ADHD is descriptive to this person. Is easily distracted and they pick up their surroundings spontaneously. Well, so what does that mean? They have ADHD. So what does that mean? That they pick up things and they get distracted. So it goes back and forth about what descriptively, but it doesn't get to the why, like you're talking about. And I always say when describing my own journey inside of sports psychology, a young Mark Glicini was always told to relax, but nobody showed me that a deep inhale and a longer exhale could actually is the how-to behind relaxation. So I care, as I shared in your intro, about like the why and the how of what drives you because you continue to create all these cool tools and certifications for different individuals. As I was going back to the last podcast we recorded, I don't even know how it slipped past me, but it was your epoch and journey as a physical therapist. Could you go into that? Because I know you even started right around the age of 30, and could you maybe
Yeah.
start there in terms of your arc to where you are now?
Yeah, I think, a lot of people that go into medicine, they were exposed to it in a way of maybe mom and dad, or one of them was a physician, or, they just had this experience growing up and they really started that journey in their teens. And it was like, I'm going to be a doctor. I'm going to be a doctor. And that just was not me. Um, I can't remember if I shared last time of why I even went down the physical therapy journey, but so my sister had 3 ACLs. So she was a couple years older than me. So I saw her first one. So we were playing varsity basketball together. She was a senior, and I guess I was no, I was a freshman, and I watched her get injured in practice. And, she tore her ACL. And then basically what happened is she did it 3 years in a row. So back then it was very different. You would tear your ACL, you would go back to sports maybe 4 or 5 months later. It was a much shorter, or, it was a mistake. But at the time, it was thought it's okay to return to sports that quickly. And so she just kept having that injury again. And so watching her go through that, I just thought, wow, her physical therapists have such like an amazing job. They're helping her rebuild, helping her get back to what she loves. And I saw so much of her loss of identity when she was injured. And I thought, how cool is that, there's a job out there that you can build someone back up and get them back to what they're doing. So that was really what said, all right, I'm going to be a physical therapist. It was watching my sister's journey. And
Gotcha.
then I loved it, but I felt like there were so many other things I wanted to tackle and learn. So pretty quickly, I ended up practicing for 7 years, but pretty quickly I thought, all right, do I want to, be a PhD? Do I want to study more and like be an educator in physical therapy? Do I want to, go be a physician or a surgeon? And because at that point I was being exposed to so many surgeons that were referring to me, I started to think, oh wow, your job's pretty cool. Like, you're so I think for me, it was just that combination of now I understand the prevention post-operative side, but I also now I really want to go back to school and learn, how do I actually do the procedures? How can I actually be the person who does the intervention that gets them back?
Wonderful. I mean, one of the things that I pulled from the initial thing is you seeing your sister go through that as a freshman in high school. What, you're in your mid teenage years. There's a random tangent that I would go on to where there's this guy named Morris Massey, who's a marketing expert, who says you are who you were when, and it has a lot to do with how your core values get locked in. And from a
Sure.
psychological perspective, it's like the first 3 years really matter for a child, all the way up to the age of 9, they start to get really locked in. And then there's this kind of like just like laying down cement where you can put your hand in the sidewalk, right? The neo prefrontal cortex is still growing, but right around 18, I know for me, when I got through my back injury and my mom battling cancer, it was very, yes, traumatic, but it shaped kind of what I was really interested in. So it was really cool to see that connection, that you had something that's like, wow, you really remembered that vividly. It's, yeah, it
Yeah.
imprinted me that much. I guess I would have us go into, because you and I were on the phone call a couple of weeks ago, where I said I'm really interested from a psychological perspective, pre-frame, reframe, and deframe, really like taking the athlete through the preparation to prevent this from happening, the reframe, which I guess would be in your case the surgery itself, and then the deframe, how do they heal from the trauma. Do you mind going into any of those aspects more specifically on how, let's start here. How do you start with the preventative side? Is that something you're really focused on, or is it more surgery and then helping them get back to play?
I would say the preventative side comes more actually at the end. And that's just because that's when I meet people. I meet people when they're already or injured. I don't often get the opportunity before they've been injured. So sometimes I will say it happens. But what, so it's kind of a little bit scrambled, but say, I operate on someone, they tear their ACL. I reconstruct or repair their ACL. They go through their recovery. one of the things we do in my practice is we do a lot of exercise testing throughout. So we start, instead of just like doing exercise testing, so whether it's like force plates or biomotion cameras or that sort of stuff, doing it on the final day and saying, hey, here's your final test. We actually start doing it as early as 6 weeks after surgery. And we do it at 6 weeks, 3 months, 6 months, 9 months, 12 months. And so the reason why we do that is because you're kind of hitting these milestones. I want to make sure you're hitting the milestones as we go. And everybody's got a different journey. So sometimes you're doing excellent in one area, not so great in another, and neutral in another. So we just sort of level set and say, okay, now the next 3 months, this is what you should be working on. And then we march all the way towards we're getting to return to sport. But the preventative piece that I sort of mentioned, I worry more about not their re-injuring the ACL that I just fixed. I worry about them hurting their other knee. So statistically, that's the thing to worry about. So statistically, after you have an ACL surgery, you are more likely to hurt the other knee, the quote unquote healthy knee, than the one that you just rehabbed. And why? So because you've spent the last 9 months, 12 months so focused on this knee, then we throw you back to the wolves. We say, go ahead, get back out on the field, the court, whatever it is. And you haven't been training that leg. You should be training that leg. But if we're not paying attention to it and working on the prevention on that side in parallel the whole time, they're at risk. So one of my missions in parallel is prevention on the other side, or prevention of like other injuries that have nothing to do with the ACL. Does that make sense?
I mean, it makes perfect sense. It's so beautiful at the same time sad, right? Because it's almost like well, where your focus goes, your energy flows, but then you might miss something else. Like from a sports perspective, when you get too aroused and too energized, your vision starts to narrow, and that's kind of good till it's not. The aperture starts closing just like you had a camera, and then if it starts closing too much, you kind of miss everything else going on, and we don't want that as an athlete. You turned me
Right.
on to this idea from Robin Sharma, who has this podcast that I used to listen to called, I guess it was like called Leadership Sessions or something like this.
Mhm.
And he introduced this idea of four different types of sets: heart set, health set, soul set, and mindset. And everybody talks about mindset, right? But I love how you talked about, looking at the other pieces of it, right? So say somebody's getting ready for a marathon, they might have the focus, they're ready to go in terms of their mindset, right? But is their body abled and conditioned enough to go the distance from a health set perspective? Heart
Right.
set has more to do with relationships, and soul set has more to do with their spirituality, their confidence, and their trust and the belief. I want to go to back to you for one more beat, Kath and Logan, in the fact that milestones. You
Sure.
seem to get to this place where you're like, okay, I'm done there, and now I'm going into this. Like as I was talking about in the introduction, it's like I can't believe how many things that you've done and poured yourself into. And how do you know, okay, it's time to move away from physical therapy and go to the next chapter versus you want to see that chapter through a little bit more?
Yeah, interesting. Right. I think some of it is just clinical acumen. You start to see patterns and all right, this is normal. This is, where like you're on track to get back to what you need. But I will say, a lot of it is data driven. So whether or not they are ready to move to return to sport program, or they're ready, or I'm noticing, we need to get maybe a deeper psychological intervention for this person. It really is data driven. Like there is a little bit of intuition and clinical acumen, but we take a lot of data from preoperative all the way from postoperative, like whether it's physical data and looking at how they perform on certain tests. Like I said, we start early, but they're also getting surveys throughout that are looking at, how is their quality of life? How is their like resiliency, their grit? Those types of things we are monitoring throughout. And that gives us, I think, a lot of data to say, you know what, we're good here. We can move forward, or we have to pivot a little bit and we need to maybe pull in another professional to help this person, or they're plateauing. And for some reason, the person they're working with, they're just not like getting to that next step. And sometimes we need a fresh eyes.
Yeah. I love the one-liner data over doubt, and doubt means to hesitate. So if somebody's hesitating, it's like, okay, maybe we need a little bit more data. And from a athlete training perspective, it's just creating proof. Like what is your time on that sprint? How many, to take lacrosse, for example,
Yeah.
times can you hit the wall in 30 seconds? And if you have that kind of proof, then if so facto, you'll have the confidence. The zeitgeist, if you will, is the talk about athletes having more anxiety than maybe they did years past or decades past. From your perspective as a physician, what are you noticing in terms of athletes struggling mentally, like inside the injuries and surgeries that you're performing?
I definitely see a ramp up. Like I see so much more anxiety than I have even like 5, 6 years ago. So I think there is anxiety just, in general, about every step of the way, like not even related to performance. So there's like more of a generalized anxiety of, day one, we diagnose, we talk about what's going on, and you can just see there's a lot of, disruption. And so I'll see an anxiety spike there. And then are they anxious about, what's upcoming? How is their life being disrupted? Is this going to affect my job? What about the money? Am I going to be able to pay for this? I'm afraid to go under anesthesia. There's so many different things that can happen throughout the whole journey. So I certainly don't prescribe myself as a psychiatrist or a psychologist. I think my job, the best thing I can do is sort of from the get-go, sort of acknowledge that there is a psychological aspect to having an injury and being able to recover from that injury. So a couple things that we do from the day they're diagnosed, we start to, try and think, how can we build a little agency here? How can I give them some things that they can control? So, one of the things I've noticed as a surgeon is if you can give them a little bit of control, that will help. I think part of what makes the anxiety really spike is I have no control. I have no, like, this ship is just sailing and I'm not a captain. And so that little bit of control might be really small in the beginning of like, I'm going to give you these 2 or 3 things that you can do this first week. Like, I need you to get your swelling down. This is how you're going to do it. I need you to set up this appointment, and you can go to 1 or 2 places for your physical therapy. Pick which one works best for you. You know what I mean? Like basic stuff, but I try and from the get go build a little agency in the process and then find ways through the whole journey to do that.
Wow. I mean, the couple thoughts come to mind, but the main one would be there's some of these paradoxes or seemingly dichotomies in psychology. Like, for instance, one of the things, if somebody's being very self-conscious, they're thinking about themselves too much, therefore they should go take care of somebody else. And it's kind of like,
Yeah.
really? Like they should go take care of
Yeah.
somebody else if they're not doing well? It's like, yeah. Like
Yeah.
if somebody has to take the dog out, for example, it's like you even taking care of another beating heart can help you. And it's really cool how you're like, why are you giving them things to do? They're the one going through the pain, but that actually gets them out of the pain. So it's really cool to see kind of how you go about that. Is there anything else you do for them? I mean, right from the day that they're diagnosed, or you start building the agency, but what else, maybe even just personally, do you do to kind of ease them?
So I think a couple things that I try and think about. One is they're always going to remember how I delivered their bad news. They might not necessarily remember what I say, but they're going to remember how they feel. So I try and make sure, okay, am I in a space that is like quiet and controlled? Do I look distracted? Am I looking at my phone because doctors are getting called all the time? You know what I mean? So how do I look? Do I look? So sometimes you get attached to people, right? You might know this person and this family, and I might internally be very upset for them, but I need to sort of make sure I'm ready and in control and not sort of being emotional, right? So I think about I'm presenting in a very neutral way. I'm presenting in a room or a situation that feels really calm and private. I shouldn't be standing and looking down to them. I should be at the same like level as far as like our eyes, which doctors are oftentimes just the way rooms are built. Sometimes someone's sitting on a table and we're standing. So I try and level set, where we are. And then the other thing is like I try and have a plan, even if it is not a full plan, but I want them to, again, like have a little bit of a, okay, I have a team, I have someone that's taking care of me. This person is also saying, hey, here are my next steps, and this is what we're going to do. So I think those are like the easy things that I try and do from the beginning.
I'm just sitting here smiling because, I mean, one of my favorite things to do is talk about communication. I really believe that that's kind of at the essence of everything that I talk about in sports psychology, right? Communication meaning to make comments. So, what's common for that individual? Like, you'll see a lot of people who they do struggle with negative self-talk, and it's under this limiting belief that they believe they can't get out of it, but it's just a rehearsal and a positive feedback loop that leads them to that. So, but when you were talking there, just like the tone in which you deliver it, your nonverbal body language. I always am talking about how like there's a certain texture to how you even say things. Like I can say, Dr. Logan, what are you doing? Or I can say, Dr. Logan, what are you doing? And there's like a different, sometimes it tastes like cough syrup, and so other times it's cold lemon water. And what we want to really do is make sure that our communication's on point. So the one liner there is that setting influences mindset, and I can see how you're even when I'm working with a team. Sometimes one of the most important things you could do is put us in a circular formation before we even begin it. It's like forget about what even we're going to talk about, but just this whole circle that we're in says that everything's going to stay here.
Mhm.
When did you start to really? I know you mentioned it right at the top that you were frustrated because it wasn't really getting in there into the conversations about the psychological aspects of surgeries and things like that. When did it really grip your heart where you were like, you know what, I really need to do something about this mindset inside of the surgery and the things that I'm performing?
I mean, I think it was a little bit cumulative in the way that I remember my sister's experience. And I think she had a great surgeon, great physical therapist. It wasn't, oh gosh, they're not doing a good job. It just was like those tools weren't, it just wasn't spoken about. It wasn't part of the process. And I saw what was happening at home, and for her, and I know she won't mind me talking about it because that unfortunately, this has been a big part of our family. Both of her daughters have also torn their ACL, and I've had to
Wow.
operate on both her daughters. They're both college athletes. And so it's, you see the impact that it has on these families, and you see the athlete identity and how much they just feel like they're taken out of who they are. So I think that's number one. That's sort of when it started to build. But then when I was working as a physical therapist, you would see it all the time too. Like you would be working with these people, you think, gosh, okay, I think they're doing well physically, but they would, maybe every once in a while be in tears, or they would say, I'm really scared that I'm going to get hurt again, or I just don't feel like I'm going to be the same player. And they felt like they were letting people down, almost like they're feeling shame. And so that was sort of, that was like as I was working as a therapist. And then when I went into medical school, it's not part of the dialogue at all. Like you're just so focused on you have to learn how to be a surgeon, right? So there's just no part along the pathway of learning all of those subspecialties that anyone is sort of saying, hey, we have to do something about this. But the ironic part is in the literature, the medical literature, it's so very clear that the problem about getting so when people are trying to get back to sport after ACL injury or even shoulder instability surgery, the problem isn't physical. If they want to return to the same level of performance, so not just return to the sport, but they want to get back to the same level. So D1 to D1 or D3 to D3, whatever it is. If they want to do that, the thing that gets in the way the most statistically is confidence, psychological aspect, fear of reinjury. It has nothing to do with physical.
Um, you know, I do want to ask you about the home front and the environment that you see for the individual that you perform surgery on, right?
Sure.
Of course, you can do your very best to make sure the setting's right and your tone's right and your eye level and you're paying attention. Just one note that I want to say is I came across this cool idea that we wouldn't have fear unless we had a memory. The only reason we
Mhm.
have fear is because this reminds us of that. And when we use the word emotional reaction, it's happening again. So here's this action that used to be similar to this. So one of the things that we do from a psychological perspective is we go in and try to like a working document, we try to update the story there. Okay, what's the story we tell ourselves about this scenario? And when we can go in there and say, okay, next time the scenario pops up, this is going to be we're prepared to do this sort of action. And honestly, it really is that simple, right? It does take rehearsal and repetition, of course, right? But they have a script that's running every single time this shows up. And therefore, this means fear. This means fear. This means fear. If we can edit the document, right, we can start to get better, just like repping out anything. So coming back to you, it's not in the literature. It's you're all hands on deck on becoming a great surgeon. You now have to figure out going from therapist to physician and delivering that news. What do you see? You know, you keep saying that you're not the expert and you're not the psychiatrist, but you've seen this many times. So what do you see as like, don't do this versus do this, like from all your images and snapshots of the family's influence on the individual that got hurt?
Oh, that's interesting. That's an interesting question from the family. One thing that I see that is such a response of love and care that I think can be harming is mom or dad saying, "I'm so scared you're gonna get hurt again." Like, you know what I mean? Like I see that all
Yes.
the time. And because it's a trauma to them, watching your kid go through this. It's awful, right?
Yeah.
But my sister is a PA. She's smart. She has a PhD. She did this all the time. She'd be like,
Um,
"What if you get hurt again? I don't want you to have to go through this again." It's such like a statement of love, but it's harmful, right?
yeah.
It's not the statement that we should be making. We shouldn't be sort of continuing to introduce the fear, or now I'm scared about getting injured, but now I'm also scared about letting my parents down. you
Uh,
know so there's a lot of layers there. So I try and sort of pull them out of that sort of behavior and just have them focus, because they also want a job. They also want some agency and something they can do. So I try and give them something to do. So I think as parents, they can be so helpful with trying to get some good food in the house, like understanding like what are the foods that help injury recovery. What are the supplements? Talking to them about like vitamin D, talking to them about collagen, protein. There's big protein deficits after the surgery. Like our body is so busy when we're healing that we really need more protein than normal. So, I think trying to get them on a job of like, all right, you can be very, very helpful with like getting some great food in the home, making sure that they have the nutritional resources, making sure like they have the ability to get good sleep, setting things up for them. They can do a lot of really helpful things. But I would say oftentimes the parents almost re-traumatize all the time because they talk about how hard it was for them to see their kid go through it.
Yeah. What fighting anxiety fuels anxiety, and what you
Yeah.
resist will persist. What you let be will let you be. It's just interesting because you're absolutely right that their heart posture is out of love. I want to do this for them. But what I find, and this was very difficult as a young coach, right? Somebody comes to you with a question. What do you think? I got to give them an answer, right? And usually, like that was my main thing years and years ago. It's like, okay, they're coming to me. I got to give them an answer rather than volleying back a question, which now puts them on a quest. It's inside the word question. And then now they go, oh, like, yeah, what could I do with that? And it's putting the agency back to them. And I think that's a
I love
difficult thing to do. I want to send this part
that. Mhm.
to the athletes that I work with that are coming back from an injury. I know what I would say to them, but other than them focusing on getting their nutrition in order, specifically the protein, could you give them a few things that they could really focus on, right? They're either on bed rest or they're in a sling or they're in a brace. What should they be pouring themselves into because they feel like this is dead time, right? When I get back, then my life starts over, but really they can invest this time.
Totally. I think, Mark, that's great. A great question. So I think there's so many things. So say we just choose a scenario if it's one of your lacrosse players and they are out and they're so focused on some sort of goal. They want to get back to X team because they want to compete in X event. Um, I think it is you can reframe it as such an amazing opportunity for yourself to step back and look at what else can I learn. My goal is this sport, there are so many things that we never have time to do because we are so busy with our practices and our games and our competition or recovering or doing all this sort of stuff. You actually have a little bit more idle time. And what could you be doing? You can absolutely be doing a ton with game film. and not only looking at yourself, but looking at everybody else. What can I learn about this sport? What if I was the coach? What would I be telling, my teammates? What would I be saying to them about things that we can do to get better? So I just think there's so many things that you can be like a student of the game and look at it from a coach's perspective, so that when you do come back, like, you're just going to have so much more insight. We don't always have the time to do that. So I think that is one thing, is trying to like understand a little bit of that, from the coach's perspective, what can we all be doing better, and looking at it from different angles.
Yeah, if I all I can really do there is just grab what you said, highlight it, bold it, underline it, and one of the things that really comes to mind is the messy middle, right? So confidence comes from doing what you're great at, and a lot of people are starting from scratch, especially when they're injured, and they really go, "Okay, Dr. Logan, I do want to do that. I want to get better at game film." But I can remember, just bringing myself into this just for a second, when I took on a new position at Yale. I was done playing attack. They moved me to short stick defensive midfielder. Going to watch game film with Coach Baxter, who's now the head coach at Fairfield, was like going to the dentist office. I hated it. I knew what he was going to say to me. Your approach angle's wrong here. This is terrible here, blah, blah, blah. And I was like, okay, great. But I gotta say, the messy middle has a lot to do with discipline. Like, I have to, I got to, I have to, I got to, I have to, I got to. And through progress, just like strengthening in anything, you find desire, which is I want to and I get to. By the time I was a senior, I was like, I cannot wait to watch game film, because I knew how it was correlating to me getting better, coming back to the purpose
Yes.
behind why you watch film. Dr. Logan, you treat your profession from an outsider perspective like an athlete. You train, you practice, you learn. I guess I would just click on the suggestion you're giving that student athlete that's seeing the opportunity to learn. How do you go about constantly improving and evolving inside your own craft?
So there are a couple ways. I think you have to track your outcomes, and tracking your outcomes takes time. It is. So how do you track outcomes? Outcomes are looking at when I was talking about how we're evaluating patients and they get surveys. Part of that is like looking at, how are they doing as far as those are outcome measures. So basically, it's like, are they getting back to all their quality of life things? Are they getting back to their activities levels? If they're not, why? Another part of what we're tracking is looking at things like range of motion, strength, return to sport. And then the same thing when everything we do in the exercise testing lab, like, we are looking at, physically, how are they doing? So then you get all those data points. You have to take time to go through them and start to analyze them. How am I doing here? Did any of the ACLs fail? If so, why? Was there something I could have done to get better? The other thing you can look at is like your efficiency in the OR. So if I take 4 hours to do a surgery versus 2 hours to do the same surgery, it's a big deal. It affects like the swelling of the surgery, the pain after surgery. You don't want to be fast and sloppy, but you also don't want to be slow and, be taking too much time on each step. What happens intraoperatively is soft tissue start to get a little bit more swollen. Sometimes visualization can get a little bit more difficult as you like are taking too much time. So you can look at your OR efficiency as well.
Wow. So I'm hearing tracking the outcomes. There's kind of like a personal responsibility in doing that. I think like I know, for example, me too,
Yeah.
back in the day, but I guess as I've come and matured as an athlete, I've become more interested in getting the feedback. But I know a lot of people just like shy away from it because it's like,
Yeah.
I don't want to know that. That would be, it's almost like
Right.
stepping in this on the scale sometimes. You're like, I don't want the truth. But I think like right when you get through the truth, you're able to get through the rainstorm that's coming to you, and there's sun on the other side. If I'm listening to you correctly, which I believe, I couldn't agree more on your statement on efficiency, but getting that down, that like right amount of time, you don't want to be sloppy, but you also want to go about it the right way.
Yeah.
Not not taking just it upon ourselves. But one thing I've noticed about you, Dr. Logan, is you're very team oriented. It seems
Mhm.
like you go to this person, right? You're a co-host of your podcast. You have a co-founder of different businesses. You've brought me in to do some speaking engagements. I'm like, this is so cool. But where did that type kind of team aspect come, and why are you so team oriented?
I think that's just sports. I think it's just that if you speak to a lot of orthopedic surgeons, they generally have an athletic background, and a lot of what when you are in the OR and you're the lead surgeon, you're essentially the captain, right? But it's not like you could just do it by yourself. You need your anesthesiologist, you need your surgical assistant, you need your nurse in the room. You also have medical device reps that are in the room. So it's like you're the captain of your team, but you certainly couldn't work without them. So I think not to say every surgeon does a good job at managing teams, but the people who are drawn to surgery oftentimes have that sort of background. So I think it's that experience, growing up playing sports. I talk about that all the time with athletes. Like, sometimes there's so much fixation on, oh, my kid is going to go D1 or they're going to play professional or and my boys play sports. They love it. They play competitive sports, but I look at it as they're they're learning so much for their future selves. Whether or not they go play at a high level somewhere, who knows, and I don't really care. That's up to them. But what I do love about it is those wins and the losses and the, getting upset about being called on a penalty or, it's all lessons. They're learning things every time they're out there.
Beautiful answer. I'm going to bring this back to mind because I don't even know if you remember saying it, but when I was listening back to our first podcast together, I asked you and Mike Genta at the end to define greatness. And one of the things that you said is, I think is being open to being wrong
Mm-hmm.
and then growing and having the capacity for change. So open to being wrong and having the capacity to change, which is learning and which is
Yeah.
that exactly your last answer. Let me put you on the spot and say, is there anything over the last several years to a decade, right, that you used to think was true, but you kind of gotten rid of that and now have evolved, whether it's you as a physician
Yeah.
or as a parent or just in general?
I wouldn't say there's something that I'm like, oh, wow, I used to think this is true and it's totally changed or whatever. The only thing that I would say has like evolved over time is I think even with running teams, I've become even more like patient and more open to different styles. And I think that just sort of comes with, age and experience, that things that I would have said, oh, we really need to do it this way. I sort of over time have said, you know what, this is going to work a million different ways. We can, it's like giving someone choice or agency. When you're running a team, I want them to have choice and ownership too. Like, I think having sort of a little extra responsibility on everybody else's shoulder makes us all perform at a higher level. Does that make sense?
Definitely.
So
And I'm going
I
to
would
lean
think
into
that's
this.
what changed.
I'm going to lean into this a little bit because I usually, if I'm listening to all these different podcasts, if a line grips me, I kind of let it grip me for a while and see why is this gripping me. And one of them that's gripping me right now is we can only open doors in others to the extent we have opened those doors in ourselves. And I thought that was like
Mhm.
really cool.
Yeah.
So you ever meet somebody where you say how they're doing, they're like, good, good, you're good too, right? And they really don't seem to have that capacity to hold space. You could say, okay, that person, not to be mean or anything, but they just have a bunch of closed doors, right? They haven't done the deeper work. So I want to lean into that and ask that to you because I'm seeing in a lot of your answers, you're super kind and humble about it. So you're like, okay, that's just yeah, because I've always been. But you have this nature and thing that you've nurtured inside of yourself to be wrong, to learn, to become more patient. So I guess I would ask you, is that a skill that you've been working on? Where did you kind of learn that from? Is there a role model or mentor that taught you how to be
Yeah.
like that? Or why do you open so many doors inside of yourself to get deeper and deeper into your craft?
That's interesting. I'm not sure anybody's ever asked me that. Or I would probably say that as mom and dad. I think you're kind of there's a lot of reminders like and I can think of a million examples in life where like you brought up service earlier, essentially like doing something for someone else. And I think there was a lot of that growing up where, I didn't come from physician parents, but there was just a lot of involvement in the community and a lot of like, yep, you might be good at this, but like, look at, what this person does for the community and that person does for the community. And not to sort of say, hey, they weren't giving me confidence and sort of trying to build me up, but they're also reminding me like how great the community as a whole is and all the things that people you interface with every day, what they're bringing to the table, whether they're at a different, like, from every level of socioeconomic status. So I think there's sort of the whole thing goes better if we're all sort of working together and respecting one another and the parts we bring to the table. So I think that's probably more of a mom and dad thing.
It's wonderful because I think it's I'm maybe I even say it every episode is I feel like the best people I come across, they have this like kind of relentless energy to keep going, and they have this kind of humility and softer side about them that like, oh, that's interesting, tell me more about that, I don't
Yeah,
really know too much about it, so I don't have this kind of like, you can't teach me anything, I have an ego
sure.
about me, but they're like open and receptive. More of a question for those out there that are taking on a lot, and like you're taking a lot on a professional side, but you also run your family and different things like
Yeah.
this. How do you personally avoid burnout and exhaustion?
I mean, I think it's always changing, right? So my husband and I have been together since 99. So we got together when we were pretty young. And the people we were in 1999 are very different people now. And you have to always be sitting down and communicating. And there's been times where his work made him travel 4 days a week, and that asked different things of me. And then there's, me going through residency with kids, and, that changed the demands on him. And I think you have to be like, just like anything in life, you have to be flexible and you have to prioritize. Okay, do we have the same values? And if you have the same values, that's all you really need. Then it's just like, all right, what do we need to do to get to that? What needs to be done for this household? So I think you got to speak up. You got to reevaluate all the time and say, you know what, I do need a little help here, or I'm feeling really burnt out. For me, though, the doing all the different things is what really helps me avoid burnout. So I think there's, the
Mm.
podcast fills one bucket, the unbroken athlete fills another, being a surgeon fills another. So, and, nothing is better than being a mom, from my perspective. So they all fill a different bucket and they all fill me different ways. So I think that's really what helps me. If I was just doing the same thing every day, I think even if I was working less, I'd probably feel more burnt out.
Yeah, it's wonderful. It sounds like the variety actually gives you vitality rather than
It does.
exhausts you, which is pretty
Yeah.
amazing, right? Because many people, it's funny because people who have that natural lean just to do a lot, right? Even on their off days, they're doing like a trail run or a long hike.
Sure.
It's like really,
Yeah.
you're really doing that on your off
Yeah.
day. It's like that. It sounds exhausting, but it really kind of is that physical meditation that allows them to kind of stimulate their mind. So I want to go into the current endeavor that you're doing, the Unbroken Athlete. I want
Sure.
you to give space and talk about that. We already mentioned your care, interest, and passion for the continuum of care, and now you're working on a new endeavor called the Unbroken Athlete. Could you speak to it a bit?
So thank you. So Unbroken Athlete really was, as we were leading up, saying, hey, there's these problems out there that we're not addressing. So it started as just a research project with Emily Perrin, who is a mental health therapist and former D1 athlete who really also understands this problem. So I basically reached out to Emily. We had worked with some common athletes and said, I want to create a program for my patients who are going through surgeries, and as they go through their physical recovery, I want to have something that they can do in parallel that works on the mental side. And so what we did is we created something that was just purely online, and we just gave it to my patients. And at the end, we were looking at, did it improve? There's so the grit scale, which I'm sure you're familiar with Angela Duckworth. It's used in the medical literature to look at, trying to predictability of outcomes. So if someone has a high preoperative grit, does that mean they're going to do better with their physical outcome? So we said, okay, let's look at when we do our intervention, are we going to see any changes in grit? And so grit, I don't think is the most perfect scale, but it's what's used a lot in the medical literature. So that's why we chose that one. And normally people's preoperative grit doesn't change. It's like preoperative grit and postoperative grit, just going through the act of rehab alone didn't do anything.
Mm.
So but it was predictive of how you would do. So
Mm,
basically, Emily and I created this intervention. We put it with my patients, and what we found is their grit actually improved.
mm,
So we were seeing that they're building essentially like resiliency by going through this program. And we were seeing that when they got to the return to sport and those end stage type things, they were doing better. So they
mm.
had more confidence, they had less fear of re-injury. They just felt like, some of these measures they were just doing better on. So we presented it at a large orthopedic meeting just for like, okay, let's show our research. And when we were there, the Haslam Foundation, which is basically they have this, they donate and create grants for many things, but they have a large fund for sports medicine initiatives. So they came in and backed the Unbroken Athlete, which is what we ended up calling it. And so now we do lots of different things. So we do interventions like when people are going through for that are patient directed, so or athlete directed. If you're going through an ACL injury, there we now have an app, and you can kind of just go through all these modules on the app throughout your recovery. We also do it for non-ACL type injuries. And then the most recent thing that we came out with was a certification. So it's called a Certified Sports Resilience and Mindset Specialist. So for therapists, athletic trainers, sports medicine docs who want to grow some tools in mindset and helping their athletes get through these things, we also have that course.
Wonderful. Well, you mentioned a lot about how you deliver to the athlete. I guess
Mhm.
for the professional out there, even like a coach of an athlete that wants is just having a conversation in the locker room with an athlete that has a grade three high ankle sprain, but still is having a very similar conversation. What tools would you give them in terms of like the things in that conversation that could really help a coach right away?
Yeah, I think one is, like we talked about earlier about how I will sort of like think about how are they going to receive this? They're not going to remember all the words I say. So I think the things off the bat are bring them somewhere private. Think about the setting, think about your body language. If you are the coach, you are probably very upset. Try and manage your own emotions and don't approach that athlete until you feel like you've taken a second and you can do that. But I think try and give them some things to do. But I think one of the most important things is don't sugarcoat it in the way that you're acting like it's not a big deal. I think that's another
Mm.
tendency we tend to have as professionals is to say, like, yep, this happened, but you're going to be fine. Like you're almost trying to minimize what they're feeling. So I would be direct, so say it's like, this high ankle sprain that can take some time to get back. And you say, this is what's going on. We know it's going to take this long till you get back. But then let them know, but these people are on your team and are going to help you. And then just kind of zip it. Like let them, like I think sometimes we overtalk and you just sometimes have to give it a little bit of a pause and let that person feel whatever they're feeling and wait for them to respond instead of like filling the void.
I mean, I couldn't agree more. I'm sharing this as often as I possibly can. I just read through the book Super Communicators, and my main takeaway from it was people want to either be heard, helped, or hugged, which to
Mm-hmm.
me was a lot of they want to be listened to, loved, or led. And I think if you can have that dexterity to hold space, that just goes such a long way because like I said, it's very natural. Even the parent that you said, I'm so scared they're going to get hurt again.
Yeah.
It's very natural to have your internal turmoil project onto someone. And, I guess this goes all the way deeper into the importance of emotional regulation and being
Yeah.
able to have the right self-talk with yourself. I guess one more question on the unbroken athlete would be if and when it is successful many years from today, what does that look like for you? What is the unbroken athlete able to do?
I think if and when it is successful, what that looks like is that we are giving both individual athletes and professionals slash coaches tools to help with this problem. So what do I mean by that? I mean that the problem is going to persist, but we need to start to provide solutions. So when you spoke about that, athletes will revisit the trauma. So, say you get hurt skiing, you tear your ACL skiing, that can be a high velocity, violent crash that, and maybe they're getting sled down the mountain, to toboggan. That's a trauma. We can't really necessarily take that away. So the problem is going to persist. But can we give the athlete and then the people around them the tools to help them, that it doesn't become, a barrier that doesn't allow them to return to the mountain if they want to.
Right. I think it's more of a full circle question for me and on my heart, because when I hear tools, I'm thinking about, okay, this is what's happening, and here's how you're going to get through that. I love how,
Yeah.
you're taking that second tier, but I think the third tier that we kind of started with was you were so interested in have a deep crave. I like this one line that all cures come from curiosity. You have this deep curiosity to understand why something happens. More individual question pointed towards you. Why are you doing all of this? Why from the unbroken athlete to
Yeah.
the podcast, etc. Is it just to keep yourself busy, or what's the deeper purpose?
I think the deeper purpose, again, goes back to family, goes back to values. I think it's that like service heart, right? So you're thinking about like, how do I serve my community? What can I be helpful with? And that can be, so if I think about my dad was a finance guy, right? He's a numbers guy. But he gave like service to the community by doing a lot of, like taxes, finance, help to like people who didn't have access to those things, or like to he did it for our local priests and parish. Like, you know what I mean? Like it was just sort of like, no matter what you're doing, you should, whatever your skill set is, you should also be thinking from a service perspective of like, how can I share that and make life better for certain people in that community? So I think it really is, it comes back to like, our time on this earth is so, short. What can you be doing to sort of leave your stamp and make it better?
Wonderful. I always kind of knew that about you ever since I met you many years ago. It was you didn't just care about what I was going through injury wise. You really looked deeper and had that service heart about you. For someone, kind of as we're getting to the fourth quarter of this podcast, for someone that's listening, and obviously they hear me complimenting all the things that you're pointing yourself towards and into. Um, I want to ask you more about where do you get your energy? Like, how are you? It can be as basic as, oh, I fuel myself correctly nutritionally, but is it more of that spiritual side that really galvanizes you morning through the week, through the months and the years, or is there something else that gives you that vitality to take on all these things?
I think so. Like, I think part of it is, you know, as you said, we used to talk about this as a family all the time. When you are in need and someone tells you, all right, go out and do something for someone else, like that just seems so counterintuitive, but it's really true. It's something that we do as a family all the time. When my kids is even having a bad day or whatever, I sort of say like, all right, let's go out and do something for somebody else, and we did this last night. My son and I went and delivered some food to this and clothes to this woman's house who needed it. And I just saw this total change, in my kid who is like, annoyed about this, something so silly. And, I think it's a good reminder of like, when we do this, like it really does, it's almost a selfish endeavor, right? It fulfills you, and like you think of it as like, oh, I'm doing something nice for someone else, but you're actually like, you're very much doing something for yourself and your heart as well. So I think that's part of it. The other thing I was going to bring up too, just because I know you're a reader, and there's a book that we read as a team last year that was, I think, really changed our team. And I'm forgetting the author, but it was Unreasonable Hospitality. And it's about oh, you have it, don't you? I love it. Did you read it yet?
Yes.
Oh my God, I
Please
love
keep
it.
going.
I love it so much. Okay. So the premise, but we read it as a team. I, all growing up, worked in the restaurant industry. So I've always, been interested in restaurant, books, and but the concept of the dream weaver in there. So, and just for your listeners, so they basically, this very fancy restaurant had this dream weaver position on staff, and that person was their job was to identify moments that they can make for guests. And they had a little bit of a budget even to sort of do something special for a guest that would just be super surprising and, again, leave them with a feeling. So we read this book as a team. We did it as like a little bit of like a book club. And then I gave two people on my staff, one who worked more in the back with patients, like sort of a medical assistant, and then one who was more at the front, so like front desk type stuff. I gave them not the budget that they had in New York, but a small budget. The budget in New York was quite large, and just sort of said, you know what, that's for you guys. You guys just figure it out. If you see a moment that you can make for somebody. And I think when somebody was going through something and they would do something, an example would be, someone's going through a surgery, they're super, upset for, good reason. But they mentioned their dog. And so Anna and Britt would go and, buy something special for the dog and get the dog's name put on, a biscuit or whatever, and make it, write a little card. And, the next time that person came in, give them that. And it was just sort of this moment like, wait, this office is really these people, this team is really listening to me. They care about me, and I think those moments did two things. They were great for the patient because they felt like part of something and they felt like they were really seen. But then it also gave a lot of like agency and like responsibility and service to the staff. So I think like there's something about that, like that service heart that I think just, it made our whole team, like we would be so excited by these things and they would come back and they'd be giddy and just be like, look what I just did. And I came up with this concept. And like, I would be excited, and that kind of goes back to what I was saying earlier, that I've sort of, I'm less particular about how certain things are done. So that's an example. I'm super hands off with it. I'm like, I trust you guys inherently. Like do it. Like, I know you're going to come up with great things instead of trying to control it. And it's made, all of our lives better.
Amazing. You made me well up there for a second. And I think the reason why is because um, the truth of the matter about of it all is I think we were talking about it earlier when you said track outcomes and
Yeah.
efficiency is when I'm talking to young athletes, there's an athlete that I work with that really didn't was struggling, really undersized as a freshman, sophomore. And rather than coddle them, I said, listen, you're not working hard enough. You're extremely small and you have to do this, 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 and this. And that person just committed 3.5 years later. This is not about me. This is
Yeah.
about the truth, right? Or
Yeah.
when you deliver the truth to them, now that kind of like sets them free if they want to take all of that on. And I think that sometimes as coaches or practitioners, we try to sugarcoat the thing, but that kind of is,
Yeah.
soft or smooth roads and rough later on, rough roads and smooth. And if you can deliver it right now, at least they can, in that rough road, gather friction to go to do something amazing. And then, the psychology piece in me would have to say this: the brain is only cares about predicting and protecting. And how I was going to start this podcast, how I said she's always evolving, I was thinking about that a lot. I was going to say an ever evolving hero, because hero means to serve and to protect. And I've thought about, that is you, Dr. Logan. You think about people. You don't just think about yourself. You think about other people, right? You're petting your dog even as we're doing this, right? Because you care so much about others. Now, the other piece of that from unreasonable hospitality is the prediction, right? So if I said, guess the next words that are about to come out of my, you already
Mouth.
have, yeah, you have
Yeah.
something, but that's what we're doing longer term, extended, right?
Yeah.
So 11 Madison Park, where they're like, what car is yours on the street so that we can go pay the meter if there's too
Oh
much?
yeah.
Or they're listening to those people. We had such a great time in New York, but we never got that like street hot dog. And then they go
Yeah.
out and get the forced hot dogs for them. It's like, if you're, I say this a lot too on these podcasts. Stephen Sondheim, the greatest musical composer, arguably of
Mhm.
all time, when he was asked, how do you create such great music? He said, I listen. And I think that's such a beautiful thing that
Mhm.
if you're kind of paying attention and paying attention, attention and love are the same kind of thing that you have that protection side down, Dr. Logan, I'm telling you, but then going above and beyond and predicting what they need or what they care about, that's kind of how you can bring the EQ into something that you're IQ competent on. So let's kind of land the plane and let me ask you, is there any question that you wish I asked you that I didn't?
No, you asked me so many good questions. Yeah,
There were kind of deep level questions. I was like,
no,
okay,
they're
maybe
good.
she doesn't want to go there.
No, I don't mind at all. No, I mean, I always love speaking with you. You know, we've been speaking for years and we keep circling back because I think we think um, similarly and, you know, want the best for people and are always trying. We're both very curious at heart. So I always enjoy speaking with you.
So one more statement, and then I'll let you take us home. Is I write all this down as you're talking, right? And the reason
Yeah.
why I do it is not because of the unreasonable hospitality. It's kind of to see kind of what you care about today, like really what's on your heart. And one of the words I wrote down a lot had to do with recovery. And it's
Yeah.
kind of like the reaction piece that you're acting again, but you're really recovering the true authentic self before you were broken or fractured or had the
Yeah.
divide, whether in bone or otherwise. And I guess it's just on my heart to say that, you know, being someone who's gone through injury myself, had my mother go through cancer and really take on this mental performance coaching because of a past pain in me is the recovery piece, you're not really the same person. And if you really want to transform that pain into a higher purpose, it can actually be one of the best things that happened to you. So I'm not really saying, you know, I wish more people had pain, but there is something. I forget the philosopher's name. Maybe it was Eclatus is his name. He said, "Suffer into truth," which had a lot to do with like you want minimum necessary dosage of suffering because of who you could become on the other end of it. And I don't think if you didn't see your sister going through that tough time,
Yeah.
maybe you don't take this trajectory. And if it's not on your heart to help that person down the street, that hurts me. I'm not okay with that. You know, you don't have the lesson to give your son. So I guess is there anything there would you hinge into? Because I think recovery is what we're after, but yet that person that goes through surgery or goes through the trauma, they're not necessarily the same person ever again.
I mean, I see it all the time. I see people who, you know, they go through that hard thing, that surgery, that injury, that loss of playing time, whatever it is. And not everybody, but so many people come out on the other side better, you know, and more thoughtful, more grateful, more resilient, you know, a better player. You know, you see it all the time. I've had multiple people change careers, you know, in the midst of it. People will move on from relationships that weren't the right one. You know, it's just that introspection and sort of that time to say, oh, I don't like what I'm dealing with right now. But if they do it right and they really dive deep, they start to really open up and think, what do I really want? You know,
Hmm.
and they make a lot of decisions. So it's interesting to see. And I will say, like, even outside of the athlete and then becoming a better athlete, I see people prioritize more. And that's what I mean about sometimes I will watch them change relationships. The person they came in with in pre-op was a different person at the end, or maybe they're by themselves and they're happier. And you know, you see a lot of change in who someone is. And I think it's that reprioritizing and start to say, what do I really care about? What's really important to me? What do I really want to do? So it's a pivot point that I think can be really powerful for people.
No man or woman steps in the same river twice, for it's not the same river, and he or she is not the same man. One final note from a psychology perspective: Sigmund Freud, who was a mentor to Carl Jung, who I think is one of the deepest thinkers in psychology, Freud said, "Anytime you're depressed, it's anger turned towards yourself." Which is something interesting to think about, right? If you're ever really, really down, take that anger and pour it into something else. We already talked about that a lot today in this podcast, but you have this anger, it can actually be useful if you put it behind you and allow it to drive you forward. So I look forward. Maybe you want to tell the listeners about December 1 and the things that are going
Sure.
forward, but I want to give you
Yeah.
the microphone to take us home about that, but also the things that you're most excited about in terms of the
Yeah.
unbroken athlete and otherwise.
No, I'm excited about all of this. And, you know, first I want to just say thank you. You know, I have so much respect for you, you know, for so many reasons, you know, just of who you are as a person and who you are as an athlete, but also I love that you're doing coaching now. And I think that's one of the best professions in the world is, you know, coaching others. And it's so important. And so I love that, you know, you're doing more. Um, I'm excited about. So we are on December 1st recording a special live webinar that's really focused on prepping for game day. So you see so much with the young athletes. We talked about anxiety earlier. So I think it's whether they're feeling anxious about their performance or they're feeling anxious about, letting a parent down or who's watching or, whatever it is. I love sort of diving into how can we use preparation and predictability to improve. So I'm excited to talk to you and Emily Perrin on this topic. So that is all launching soon. And then the Unbroken Athlete, I think it's totally fine to say that we're going to be launching something that is directed towards the surgeon. So I will say when we're together with the PLL, I enjoyed so much just listening to Andy Towers in the locker room as your coach. And really, I think surgeons, when we're prepping for the OR, it's our OR day is our game day. So what happens though, when we leave residency and training, we lose our coaches, we lose our mentors. And I think that's not great. And I think my experience with the PLL and Team USA is that I love being around coaches. I love being in that environment and really taking some of those lessons and applying them to my life as a surgeon and leading that team there and being the captain of my team in the OR. So I'm excited to collaborate with you, Mark, and on future projects related to not only just the athlete, but how can we be working on mindset with surgeons.
Wonderful. Thank you so much for taking the time to come on here. I appreciate being your teammate. I look forward to taking on those projects with you. And thank you for being a guiding light for a lot of people, because I think that there are people that are constantly trying to innovate and move something forward, and you're not just okay with where you're at ever. And I think that is a true testament to your leadership in the field. So keep being you. I hope this is the second of many podcasts to come in between us, and we will talk very soon. Thanks, Dr. Logan.
All right. Thank you.